Myocardial infarction, or MI. What is it?
Hi, Mr. Jones. How are you?
I'm doing good, thank you.
Great. Now let's see. It's been about a month since you were in the hospital with the heart attack and we put in that coronary stent. How are you feeling?
Oh, I'm feeling great. I feel like a new man.
Excellent. Glad to hear that. And how are you doing with all your medicines?
You know, I can't tell you how good I feel since you put in that stent.
A month ago, Mr. Jones woke up in the middle of the night with severe chest pain and pressure. He previously had been well, but he has a medical history of high blood pressure, high cholesterol levels, and smoking. Mr. Jones suffered a heart attack, in medical terms, a myocardial infarction, or MI. The word myo means muscle, and cardial is from the Greek word cardia, which means heart, so myocardial means heart muscle. The heart needs lots of oxygen-rich blood to survive. A myocardial infarction, from the Latin word infarctus, is the irreversible damage of the heart muscle that occurs when the heart is deprived of oxygen. The term to describe myocardial tissue death is cardiac necrosis, from the Greek word for death. Necrosis is the result of not enough blood flowing to the muscle tissue. During an MI, there is a decrease in blood supply to the heart, which is commonly referred to as ischemia. Ischemia is caused by constriction or blockage of the coronary blood vessels. And the term used to describe constriction and blockage of the coronary blood vessels is atherosclerosis. The most common cause for MI is the buildup of plaque in the coronary arteries. Let's take a look at what happened to Mr. Jones last month. His problem started in the left anterior descending, or LAD, coronary artery. Atherosclerosis is the term used to describe the buildup in the inner lining of his coronary arteries. This buildup is a compilation of several substances such as fat, cholesterol, clotting material, and cellular waste products. The resultant buildup of these materials is called plaque. Plaque is dangerous because it may partially or totally block the blood's flow through an artery if a piece of the plaque breaks off or a blood clot or thrombus forms on the plaque surface. While Mr. Jones' plaque buildup has been going on for some time, it was a month ago that the coronary artery became fully blocked. If the blood flow to the myocardium is not restored, the damage becomes irreversible. What is this area of decreased blood supply called? That's right. During a myocardial infarction, there is a decrease in blood supply to the heart, which is commonly referred to as the area of ischemia. Ischemia is caused by constriction or blockage of the coronary blood vessels. It might help to think of a pebble dropped into a lake as you think about myocardial ischemia that is sustained and ultimately results in tissue death. The rippling effect of this pebble is similar to the area of ischemia that has the potential for growing if oxygen is not restored to the myocardium. What is the name of the irreversible damage to the heart muscle that occurs when the heart is deprived of oxygen? Infarction is correct. That's right, the circled area is the infarcted area. What is the term to describe myocardial tissue death? That's right. Myocardial necrosis is the result of imbalance in the supply and the demand of oxygen to the heart. Once a myocardial infarction occurs, the goal of treatment and care is to limit the size of the infarct and restore the heart to the highest level of possible function. Persons suffering a myocardial infarction are at increased mortality and morbidity risk. There are known factors that increase your risk of developing an MI. These risk factors are divided into modifiable and non-modifiable categories. Let's take a look at Mr. Jones' risk factors, beginning with the modifiable ones. Mr. Jones continues to smoke. He has a stressful job. Mr. Jones sits at a desk and gets very little physical activity. He has high blood pressure. Mr. Jones also has high cholesterol levels. The good news is that Mr. Jones is not obese, another modifiable risk factor for patients suffering MIs. Another modifiable risk factor is type 2 diabetes. Type 2 diabetes is considered modifiable because it often occurs in individuals who are obese, have high cholesterol, high blood pressure, and who are physically inactive. The risk of developing type 2 diabetes also increases as people grow older. Although diabetes can't always be cured, controlling other risk factors certainly improves your chance for reducing the risk from type 2 diabetes. Some risk factors for myocardial infarction are not modifiable, like type 1 diabetes, age, and a gift from your parents, your genetics based on family history. Aggressive secondary prevention via pharmaceutical interventions is pursued to lower patients' risk for recurrent cardiac events and mortality. The 2013 American College of Cardiology Foundation and American Heart Association guidelines for the management of acute myocardial infarction outlines 5 evidence-based pharmaceutical interventions that should be prescribed at hospital discharge. These medications include antiplatelet and anticoagulant therapies, beta blockers, renin-angiotensin-aldosterone inhibitors, and lipid-lowering statins. For some patients, diuretics are also prescribed. One strategy is to prevent or break up clots in blood vessels using antiplatelet and anticoagulant medications. Another is to reduce heart's force using beta blockers. Yet another strategy is to relax blood vessels using angiotensin-converting and aldosterone-inhibiting medications. Interventions are also used to reduce cholesterol-containing plaques in the blood using lipid-lowering statins. And for some patients, blood volume is reduced using diuretics. Management of a patient surviving myocardial infarction is complex and involves modifications to the patient's lifestyle as well as medical management therapy for improving the demands of the heart. Treatment strategies include the use of a combinations of medications, making it important that care providers are well versed as to how and why these treatments work or may not be working. Better understanding by the provider will assist in answering common patient questions about treatment option effectiveness. One of the most common strategies to reduce the work of the heart in patients surviving MI is blood pressure control. When the body's blood vessels tighten, or vasoconstriction, blood pressure increases. When the body's blood vessels relax, vasodilation, the blood pressure decreases. Think of a garden hose in which water flows freely. What happens to the pressure in the hose as it is partially kinked? In order to understand the manner in which the body controls blood pressure, please proceed to the next video in the series titled The Renin-Angiotensin-Aldosterone System, or RAS.